This videotape is designed to discuss male pattern baldness of the crown of the head and a new program available from your doctor for its treatment. By being better informed, you'll be able to make a decision concerning the commitment necessary for treatment. In order to understand more about baldness, it will be helpful first to learn something about the normal process of hair growth and loss. Now, everyone loses a little hair every day. Under normal circumstances, the loss is too small to be noticeable, and hair grows back at the same rate at which it is lost. Baldness develops when hair is lost more quickly than it can grow back. This, of course, happens over a period of years and varies with each person. While there are many different types of baldness, this videotape will discuss the most prevalent form, male pattern baldness. Let's take a look at the types of male pattern baldness. For some, male pattern baldness is most noticeable on the crown of the head. For others, it's marked by a receding hairline. In some men, the separate balding areas of the scalp may meet, leaving only a fringe of hair along the sides of the scalp. There are many factors that contribute to male pattern baldness. All men lose hair as they get older, some at an earlier age than others. A history of baldness in your family can impact on your own hair loss. A male hormone called testosterone can also play a role. Some or all of these elements may have helped create the hair loss you are now experiencing. Treatment options for male pattern baldness include hair transplants, hair pieces such as wigs and toupees, scalp reductions, and hair weaving. Now, a prescription medication is available to treat male pattern baldness of the crown. It's called Rogaine topical solution, which is for external use only. Rogaine is the first prescription medication proved effective in the treatment of male pattern baldness of the crown. It contains a topical solution of 2% minoxidil. Rogaine should be applied only to a normal, healthy scalp. If your scalp is sunburned or inflamed, contact your doctor before applying the solution. There are some important things for you to know about Rogaine before you start treatment. Rogaine is not a panacea or a cure for baldness. It is a treatment. There is no evidence that Rogaine causes hair regrowth on the front of the scalp. And Rogaine does not work for everybody. It has worked for some people, and it may work for you. Another point, successful treatment with Rogaine requires a commitment on your part. Since you didn't lose your hair overnight, you can't expect rapid regrowth. To find out if Rogaine will work for you, be prepared to make a long-term commitment to treatment. We're now going to show you some of the results of studies in which doctors evaluated Rogaine. Clinical trials were conducted in many medical centers and involved over 2,300 patients with balding on the crown of the head. Some patients were treated with Rogaine, and some received a placebo, the same solution without minoxidil. Hair regrowth was determined by actually counting hairs. Over a 4-month period, patients on Rogaine grew significantly more hair than did the placebo patients. In addition, investigators and patients evaluated hair regrowth in response to placebo or Rogaine as minimal, moderate, or dense. You will now see some examples of investigators' evaluations. This is a representative picture of a man at the start of the study. And here you see the same man evaluated as having minimal regrowth. Here's another man at the start of the study. And this time, you'll see the candidate evaluated as having moderate regrowth. Now another man at the start of the study, and a representative example of dense regrowth. After 4 months using either Rogaine or placebo, physicians reported the following: no hair growth, new vellus or baby-like hairs, minimal regrowth, moderate regrowth, and dense regrowth. A significant difference between Rogaine test results and placebo test results. It's important to understand that successful treatment with Rogaine requires a long-term commitment to sustain hair regrowth. After the non-placebo controlled continuation phase, from month 4 to month 12, physicians reported the following: no growth, new vellus, minimal regrowth, moderate regrowth, and dense regrowth. Certain characteristics favored regrowth. Age, for example. You stand a better chance if you're younger, or if you've been balding for less than 10 years, or if your balding area is less than 4 inches in diameter. You should understand that these are only trends, and that hair regrowth was observed among all groups of patients with male pattern baldness of the crown, regardless of age, duration of baldness, or size of the balding area. Before you start therapy with Rogaine, there are some important things you should know. It is essential to make a commitment to continue therapy for 4 months or longer, because it takes at least that long for results to be seen. As this illustration shows, your regrowth may at first be invisible to the naked eye, but your doctor may notice soft baby hair, which is an encouraging sign. Then, if you continue to make progress, you might see a thickening at the edges of the balding area and a gradual filling in of the area from the outside toward the center of your scalp. If you continue to respond well to treatment, the new hair should become the same color and thickness as the other hairs on your head. Once you've started your long-term commitment to Rogaine, you should keep using it twice a day, every day. However, you should know that Rogaine is a treatment, not a cure. If you should discontinue treatment, you will lose the hair you have regrown within a period of 3 to 4 months. Clinical studies involving over 3,500 patients on Rogaine and 2,300 patients on placebo showed that the most common adverse reactions to Rogaine were itching and other irritations of the scalp, which occurred in about 5% of patients. Other adverse reactions, including cardiovascular and respiratory effects, occurred with the same frequency in patients on Rogaine and placebo. If you have any coronary artery disease or are at risk of developing heart failure, you and your doctor must carefully evaluate whether you should use Rogaine. Mild burning or irritation may occur if the solution comes in contact with the eyes, mucous membranes, or other sensitive areas. If this should happen to you, flush your eyes with water. Your prescription for Rogaine comes with an easy-to-understand instruction booklet that shows you how to use Rogaine. The booklet also advises you to apply Rogaine only to a dry scalp. You will also receive 3 separate complementary disposable applicators in each package. There's a spray for easy application to large balding areas. 6 pumps give you the measured dose necessary. Rogaine goes on as a clear, non-greasy liquid. There's a rub-on applicator for both large and small balding areas. 1 squeeze from the bottle fills the applicator with the correct dosage. And in the same package, there's an extended spray nozzle for application to small balding areas or areas already covered with some hair. Again, 6 pumps give you the correct dosage. 3 different complementary disposable applicators in each package to make sure you can apply Rogaine in the easiest way for your particular type of baldness. Instructions call for 2 applications every day, 1 in the morning and 1 at night. Studies show that the most satisfactory results will be obtained by following these directions. So don't be tempted to use more or less Rogaine than directed. And don't apply it more frequently than twice a day in the hope that it will work faster. Your prescription should last for 30 days. As you near the end of your supply, plan to renew the prescription to avoid missing your daily applications. There are some important facts to remember about Rogaine. Rogaine represents hope for many balding people, but each response is individual. Your own personal response to hair regrowth therapy with Rogaine may depend on many factors, including your age, the length of time you've been losing hair, as well as the amount of hair you've already lost. Since you didn't lose your hair overnight, you can't expect rapid regrowth, so be prepared for a long-term commitment to twice-a-day treatment with Rogaine. A trial period of 4 months or longer is essential. If at the end of this time treatment is going successfully, therapy must be continued to ensure hair regrowth. Rogaine is for topical use only. It is to be applied only to a normal, healthy scalp. It should be used as directed, twice a day, every day. Rogaine is the first prescription medication proved effective in the treatment of male pattern baldness of the crown, and that's encouraging news. Remember, if you have further questions, ask your doctor.